Hello, so this is Angelica Sagath at the Osteopathy and Healing Center. Last time we left off with giving examples of when intuition would come up for me while I was doing Reiki or OMT or osteopathic manual therapy. And we discussed each of those cases, how I picked up the intuitive information so that when you are in your work setting and you pick up that intuitive information, you can relate to it, or you can know, oh, okay, this is my intuition that is coming up. So I wanted to share some more examples with you today. Depending on the time will depend on how many examples I share, but I have a couple more here. So as I was doing an OMT session with a patient, I had an image. So again, this is visual that came up as I was treating the patient, and I saw a kid being pushed at school. So I saw him being bullied. And at that time, I was working on the occipital lobe, so that part of the brain. And I said that that incident of him being bullied when he was younger was affecting the brain, or that part of the lobe, and tension down the right side of the neck into this muscle here, which is called your pectoral muscles, and was traveling to about the midpoint of his arm. And I said this was like when you were 3 years old, and he said it is true, I was bullied. I think he said it was a year later, and like the age was a little bit off, but the incident he was able to recall. And he's like, yes, I do feel that. I feel the tension. And then when I went to palpate the pectoral muscle, the origin of it, and also the midpoint of the deltoid muscle, it was very tender when I touched it. So I knew that I needed to not only work on the brain, work on the neck, release the tissues as well in the shoulder. And another example, I was working on the parietal area, this area here. And kinesthetically, I was able to pick up that there was pain, or like a deep sensation of pain inside around the brain on the left side of the parietal area. So that's why I kinesthetically picked that up. Then I went to the area and I was working on it. And the patient also felt that there was pain in that area. And as I was treating it, I felt it go away kinesthetically in my body, and also the patient felt it dissipate in their body. The next example I have was a patient that I was treating, and again, image visual. In this case, I saw an image of her climbing, and I saw her left hand holding a rock. She does do bouldering, which she told me during her assessment. So I saw her climbing, and I saw her turning to the right side to get some chalk to put on the hands. So I believe they do it so it's not slippery. They can keep climbing. So I saw her do this motion, and by doing this motion, what the body was showing me, the image was saying that that motion was affecting her left arm. And I had that image of her grabbing this bag in the back on the right side, and as she was doing that, it was also affecting her thoracic spine. And when I did the assessment, so every single time I see a patient, I'll do an assessment to see their range of motion of the spine, so I know which vertebrae I need. When I did the assessment, I noticed that yes, that part of the thoracic spine was affected. Now, I also saw an image of this patient studying and being frustrated, studying for school, and getting a phone call that was disappointing, that was also affecting the thoracic spine. And when I got the image of her studying, she was studying for exams at that time, and she did feel frustrated. Another patient of mine, she is trying to get pregnant, and I had this image. She was holding a baby on her left side, and the scene was serene and peaceful. So from her history, I know that she wants to get pregnant, and as I was doing the treatment, I just kept getting this image of her holding a baby, and it was peaceful and serene. So I related that back to her. Another patient of mine, he plays guitar, and so I'm aware he plays guitar. And so I had an image of him playing guitar, but the way he was positioning the guitar, so I got an image of how he was holding the guitar. The body was showing me that the way he was holding the guitar was affecting his shoulder. And also with the same patient, as I kept working on the shoulder and down the arm, I saw an image of the patient getting bullied and discriminated against. And the patient also told me about this incident when he was being bullied and discriminated, and how he felt angry. Another patient of mine, I had an image that they were playing soccer when they were younger, like 3 years old. And it was relevant to the patient, what the body is trying to show the patient's condition. So I related this information to them, and it triggered, yes, a memory for that patient. Again, there was like a minor, like a difference between the ages that was off, but he still was able to remember the memory where he would play tag against the lower grade and how that made him feel. So sometimes you may get intuitive information that may not make sense to you, but if you tell the patient what you're getting, what you're seeing, what you're feeling, what you're hearing, they may be able to relate to it, and it may trigger a memory of an incident that they remember that relates to that condition or that lesion pattern. And when I say lesion, I mean when something is imbalanced or abnormally placed, like the position of a vertebrae may be in an abnormal position, imbalance in the body. So yeah, this was interesting because I got another past life incident with a patient, and so I see this image of a statue, and this it's like a figurine of an African woman, and she's like, I think I might have been African in the past. And then I see this other image of a native woman, and she had feathers in her, this headband she was wearing, and there were different colors, blue, green, yellow, on her head. And she had a hut, there was a fire going, And all of a sudden she was concerned about her child who was inside the hut, and the hut caught on fire. And then I saw an image of her other children that were older beside her. And I saw this native woman crying because her baby died due to the fire there. And so as I'm in, sometimes you may get these intuitive pieces of information, like little images, a little image here, another image there, as you're working on the body. So this is what was happening with this patient. You know, I'm working on her hip, I get a part of the story. And then I go and I'm working on her neck, I get another piece of the story. So this is how this experience happened to me, to be able to pick up this information. And so I see her burying her son and feeling very sorry about what happened. And then all of a sudden I see the spirit just ascend into the heavens. And I hear the words. So now this is another way you pick up intuitive information, is by being auditory, hearing things. And the spirit voice says, "Mommy, you don't have to be sorry, I love you." And then again I see the woman with her children around the fire, and she's looking into the distance, she's thinking about her baby, and she's again feeling sorry. And an interesting thing, after relating this story as the patient was leaving, the patient says that she calls her son an angel sent from heaven. So that was a past life, and I got bits of the information as I kept working on the body, and that seemed like a very significant past life to what was going on with her body in this lifetime. And you may get past lifetimes as well when you're working on the body. If that's something that needs to come up to the surface, to be talked about, to be revisited, then it may come up. And another, so same patient, but another instance, I was working on the patient, and I heard the words, "I'm very proud of you, I'm happy with your move." So again, this is auditory, and I heard those words, and I waited to see what the source was, where it was coming from, and the sense I got was it was her grandma. Now, once I told her what I heard, she says, "You know what, I was just thinking of her. I was just thinking of my grandma." So sometimes you may sense that the dead loved one comes to say a message to the patient, and that message to them is important in their healing at that moment. So I have another example here, and this is a patient's mind that was just saying, "I can't do this anymore." And so I'm like, okay, I hear their mind speaking that they can't do this anymore, but what do they mean by anymore? So I'm waiting, and it says, "I can't do this anymore, this injury to the lower back." And then I tell the patient what I hear, and they're saying, "Yes, I remember the first time of when I had my back injury. And as you were working on me, that's what came into my mind." And then I felt some nervousness surrounding having a baby, worked on the ovaries, went to the throat area. So this was a Reiki session. And when I got to the throat area, I heard the words, "I want to speak up more at work." So I tell the patient what I'm hearing. And she's like, "Definitely, for sure." And I just want to mention something. When you're working on the chakras, like in this case, I was working on the throat chakra. Just because I'm on the throat chakra doesn't mean you're always going to get something about, "I want to speak up more." Because if you look at the literature in the Reiki books, a lot of them say that the throat chakra has to do with inability to be able to speak up. So not always are you going to get that. So you may be on the throat chakra and you may get something else that comes up, not related to speaking up. And then I get an image of this person, of this patient holding a baby, looking out the window and humming. So this is another patient of mine who's having problems having kids or infertility. The other example I wanted to share with you was a patient who came in because they did weightlifting. So I had this image of them squatting, holding the weight over them, that caused the pain in the sacral area, or the coccyx, or the little tailbone. So sometimes you may just get an image of something the patient did in the past that is affecting, that caused the pain or is affecting their body. Okay, so those were examples of visual input, or picking up intuitive information using the sense of vision. And the other example I'll give you today is kinesthetic example. So I felt in my left jaw that there was a lot of tension and just tenderness. So I'm like, you know what, I'm going to check the left side of this patient's jaw to see what I find. And yes, there was a problem there. Yes, it felt tender and there was a lot of tension. So I just released that, and then it felt better for the patient. Okay, so in this example, I saw an image, so visual, of the person swimming, and they were doing a breaststroke with the right arm coming forward. And I just mentioned that piece, "I see you swimming, your right arm's coming forward." And then they're like, "I remember what that is. That's when I hit a plateau with my swimming." So I stopped, but after a couple sessions, he's planning to resume swimming after a couple OMT sessions. And then I felt this kinesthetic pain, sharp pain on the left. And this is where the patient has a disc herniation. So in this case, I was treating a different area, which may happen with you. I was treating the hips. So I'm treating his hip, and then all of a sudden there's this left-sided sharp pain that I feel in my lower back. I'm like, we need to go and we need to work on that disc. So I've seen the patient before, but I'm like, let's reassess, let's check, which I do. But then I felt it as I was treating his hips, and I'm like, okay, now we need to go and we need to address your lower back. That's what the body wants us to do. Okay, so this next example is when I was treating a patient, and the patient already told me before I started the treatment that inner child stuff was coming up for them. So that morning when they were doing their meditation. So when you're doing a OMT session, you can also have what comes up as inner child work or inner child stuff. And so you may hear the voice of the child, inner child, like let's say age 3 or 5, come and say something or have a message. So that's what happened in this instance. And another instance, so also it was like an inner child experience where I'm doing the treatment on this patient, and the inner child has a message for me to give to the patient to assure him that he's okay. So the child is telling me to tell this patient, to tell his inner child that he is okay, to give him assurance. And he's like, oh yes, I could definitely relate to that. And I saw him when he was 3 years old, so I see an image when he was 3 years old, and I see his mom holding him by the arms. And that was, I said, a key moment for him when his right-sided jaw pain started. So the body can bring you back to the time when the pain was felt, even though the patient might not have recollection of it at the moment. When they're older, it can bring you back to when it first started occurring. Okay, and then what was interesting about this patient as well is I'm working on the body, and I keep getting this image like repetitively come into my mind's eye of a door, a green door, and it had a dark border around it with metal handles. So I'm like, okay, I need to tell the patient that I didn't know what the message was. I wasn't getting any message. I just kept getting the image. So I drew this out for them. I said, I keep getting this image. And like, oh, I know what that is. I'm like, oh, okay. And there was a door that they were trying to open in a video game. So they were playing this video game. It's the next level. As they get further in the game, they're supposed to get to this door, and they're supposed to open it. I'm like, I just keep seeing this door. So that was interesting. And another example I'll give you is I'm working on the foot, on adjusting the bones in the foot, and then I see an image of the patient stepping onto an object affecting the right leg. And this next example I like a lot, because this patient just came from a vacation and they were feeling good, and I could feel that joy and that goodness the patient was feeling. And I kept hearing his mind say, life is good, life is good, and just feeling that life is good. And so I told him, and he tells me the story when he was on vacation, how he got a postcard that said on it, life is good. So he was feeling it, he got this postcard, and you may pick up again how the patient's feeling and emotions. Now, okay, so we're getting to about 20 minutes, so I'm going to stop here with the intuitive examples. I have a couple more to share, but I'll do that in the next video. And what I'm also hoping to do is I read the book, Dr. Still's autobiography, and it was written by John Lewis. And I'd like to bring out some points there about osteopathy and its principles, and also some interesting points about Dr. Still and also Abraham Still, so Dr. Still's father who was intuitive. So I would like to share those with you in the future as well. Okay, hope you enjoyed that, and take care.